Hello, my name's Marianne Williams and I'm a specialist IBS and allergy dietitian. Thank you very much for downloading this Low FODMAP Diet treatment webinar. And today we're going to go through various sections. And what I've done is I've separated the webinar into bite-sized sections so that you can watch them each individually as and when you have time. So today, this particular section, we're going to go through background and the essential information you need to know before you start the diet. But the next sections will look at understanding how the low FODMAP diet works. We'll look at FODMAP foods, which you restrict, which you can eat. We'll look at, is the FODMAP diet suitable for those with constipation? We'll also have a bite-sized section on the FODMAP diet and your gut health. And then we'll do a summary of this restriction phase of the low FODMAP diet before moving on to the final webinar, which will look at FODMAP reintroduction and personalisation. So to move on with today, looking at the background, I want to just reiterate that this webinar or series of webinars is aimed at people with irritable bowel syndrome. So people with symptoms like diarrhea, constipation, bloating, wind, abdominal pain, nausea, gurgling, acid reflux. Those are all classic symptoms of irritable bowel syndrome, and that's who this webinar is aimed at. Now, how to use this video or webinar, I'd like you to re-watch the webinar 2 or 3 times just to make sure that you've really understood and consolidated your knowledge. The low FODMAP diet is relatively complex, and I think it really benefits if you watch the information a couple of times. You can watch it in sections, so don't feel that you've got to watch it all in one go. You could pause the video, come back to sections later on, but it is very important that you do watch the whole video, all the sections, because there is important information right from the very beginning all the way to the very last webinar. So really important that you do watch them all. So the contents of this particular one, looking at background, what I'm going to cover today is red flags that you need to see your GP for, what information will not be covered in this treatment video, other GP tests that you could have if you've got a diagnosis of IBS, who should not do this diet, does food allergy cause IBS, and finally first line advice for IBS before you even consider doing the low FODMAP diet. So first and foremost, I really want to look at red flags. Now, these are symptoms that we get concerned about and that we feel that you should see your GP for as soon as possible. So if you've got blood in your stools, unexplained significant weight loss, unexplained low iron levels, a sudden change in symptoms. So for instance, you've always had constipation and suddenly in the last few months you've got diarrhea, or the other way around. Or you're waking at night regularly with your gut symptoms. Now, I don't mean waking up to go to the loo. I mean, your gut symptoms are waking you up. Any of these red flags, and I really want you to not delay and go and see your GP. So before we start, the first thing I really want to be sure of is that you have a correct diagnosis of IBS, that you've been to see a GP or a consultant and been diagnosed with IBS. We don't want to find that actually you've got something else going on and that you just assumed it was IBS. So please go and get a firm diagnosis. The second point is that I'd really like everybody to watch the first line advice webinar before they venture down the FODMAP diet route. There's a free version of this webinar on the fodmapdiet.co.uk website. Please watch it. It will give you some very valuable advice, and the simple changes on there may mean that you don't need to go down the FODMAP diet route. And finally, number 3 would be going back to the point we've just covered. Please be sure that you're not suffering with any of the red flags noted in the previous slide. So, what information falls outside of this webinar? So what will I not be covering? Well, as a dietitian, I will not be looking at the pharmaceutical or medication advice, and I won't be looking at advice for non-IBS symptoms or other medical conditions. And I won't be looking at blood results or investigations. Other tests that you can have if you've got IBS that you can have with your GP are a full blood count, erythrocyte sedimentation rates, C-reactive protein, or an antibody test for celiac disease. Now, celiac disease is an autoimmune condition, which is where gluten in food affects the gut. It affects about 1% of the population, and the gut symptoms are very similar to IBS, so it's really important that this is ruled out. Other considerations before even embarking on this diet is that the success rate of the low FODMAP diet is roughly around 75%, but that means 25% of people won't get better. So there's no guarantee that the low FODMAP diet will be a solution for you. If you've got a history of food anxiety or eating disorders, then please seek professional advice before going down a restrictive diet route such as the FODMAP diet. And for some patients, stress and anxiety can be significant causes of their IBS symptoms. And if this rings true to you and you feel that these are particularly problematic for you and may be causing your IBS, then you may find that cognitive behavioral therapy, also known as CBT, or hypnotherapy or medication may be more effective than the low FODMAP diet. And finally, the consideration is that this diet is not suitable for children. There just is not enough research in it yet. I want to also touch on the fact that if you've got chronic health conditions that may affect your nutritional status, it's really important to seek advice from your medical team before you even consider doing the low FODMAP diet. So one of the questions we get asked a lot about by patients is it food allergy that is causing my IBS? Well, food allergy is caused by the immune system. It's where the immune system starts to try and attack a protein in a food. And that is not what is happening in IBS. The immune system is not involved in IBS. So therefore, allergy testing would be absolutely no use for you in finding a solution for your IBS. But what does cause IBS? Well, IBS is more about the plumbing of your guts. And in some people, simple changes can be enough to get rid of their IBS symptoms or reduce them down to a tolerable level. So things like changing your alcohol intake, your caffeine intake, spicy food, fatty food. Some people find that lifestyle changes, making sure they have 3 meals a day, not eating on the run, eating slowly, enjoying their food, not looking at digital appliances while they're eating. And for some people, conditions such as lactose intolerance can be more relevant to their symptoms. All of these factors are covered in the IBS First Line Advice webinar. So I'd really like you to watch that. That'll give you much more information on all those points I've just touched on. However, if you've tried First Line Advice and you're still suffering with symptoms, then it may be time to look at the low FODMAP diet. And I will go on with that and give you more details about that in the next section.